That's interesting. You mentioned that there is knee preservation and knee replacement surgeries. Can you go just a little bit more into detail about that? I think as a layman, when I think of surgery, all I think of is take the knee out, put that metal thing in, and that's all that I can do.
Yeah, knee replacement is a great surgery, when done at the right time for the right patient. So individuals, Singaporeans are very active, as we know. Age is now just a number. We have people living up to their 90s and are very active. So what used to be the norm, where someone at the age of 65 or maybe even late 50s goes for a knee replacement, today you would think, oh, wait, that's a little bit young.
Yeah.
They're living up to the 80s. And we know from common knowledge and even studies that we know that a good knee replacement can last perhaps 20, 25 years. So if we do it at 55, 50, then in your 70s, when you are probably fairly active, you're going to be needing another knee replacement. And what we do know from science is that the second knee replacement can never be as good as the first knee replacement, because it's going to be more complex surgery. You're going to be losing more bone when we remove the metal, and we're going to be putting more metal inside, which means the knee feels less natural. You'll get less out of it, and there's a higher risk of complications like fractures, infection, and whatnot. So the aim is really to delay the first knee replacement for as long as reasonably possible, so that everyone should just need one good knee replacement in their lifetime and get the best out of it. So that's the overarching objective of knee preservation. It might sound counterintuitive that I'm preserving the knee to do a replacement, but it is true. We are preserving the knee. Of course, the gold standard is to preserve the knee such that it doesn't need a replacement anymore. And we are able to achieve it in some patients when they come early. But the other aim that we speak less about is I'm teeing myself up for a successful knee replacement later on in their life. When they come a little bit later, with a bit more moderate arthritis perhaps, but they're still too young for a knee replacement.
Right.
And we think of, okay, how can I get more years out of your knee? It's just like extending the COE of a car, right? If you find that a car can still go and it's wasteful for you to scrap it, you would think, is it worthwhile extending it by 5, maybe 10 more years? That's exactly what I do as a surgeon. Can I get more years out of these knees COE? And if yes, then that gives them 5 more years of good lifestyle with their natural knee. Maybe that means from 65 to 70 years old for a knee replacement. That could mean delaying a knee replacement in someone in their 40s or 50s. Right? That's really the concept of knee preservation. And ultimately, it's about giving patients the information they require for them to make an informed decision. I'm sure if you were a patient and you were told for a long time that knee replacements are the only option, and suddenly you are being told that not really, there are other options, but they come with pros and cons, and you make the decision what is good for your lifestyle and what you want to achieve.
Yeah, so it really depends on the individual as well and how they want to live their life. If they want to be active, or are they going to be more sedentary, maybe just go for walks versus someone who's trying to run again.
Absolutely.
Then that will probably change what type of surgeries and what type of interventions that they are looking